Hi there, and welcome back to the coping skills class. I'm glad you made it back. And today we're going to be talking about diaphragmatic breathing, or some other people call belly breathing. And what that is, so if you've been in band before, you probably know diaphragmatic breathing. A lot of people, when we're breathing, we're not really realizing it. But I want you to just take a few seconds here, and I want you to just notice whether when you're breathing in, do you breathe and your chest expands, or does your belly expand? And I want you to just take a few seconds and just see what's going on for you. Okay, so now most people will breathe and their chest is like just kind of rising, and if you're a shallow breather, you might even notice that your neck is starting to come up and you just short rapid breaths. And so this is what ends up happening a lot with people with anxiety is there's that short rapid breathing, and it starts to use more of the neck muscles or the scalene muscles to help you breathe rather than your diaphragm. And so to try and promote relaxing breathing, we're going to switch gears a little bit and we're going to get you to use your diaphragm. Now, it's going to be a little bit, if you're not used to this kind of breathing, it's going to take some practice. So don't worry if you don't get proficient in it today. But what you want to do is, I'm going to just take a step back here. So if you are doing diaphragmatic breathing properly, what you want is, what you can use as a monitoring is you can take one hand on your chest and one on your tummy, and if you're breathing with your diaphragm, your belly's going to expand and your chest isn't. So I'm going to just come back here and we're still in cue. So there. So I'm going to just breathe, and so with that being in frame, my diaphragm, I was breathing with my diaphragm and my chest wasn't moving very much at all. Now, some people find that they have a hard time doing this technique sitting up. And so if you're finding like, nope, I'm doing this, I can't do it, it doesn't feel right, I want you to lay down, and then you can just, again, put one hand on your chest, one on your tummy. And you don't have to do that when you're doing this exercise later, but if you're wanting to it's a good monitoring tool to see if you're doing it correctly. And if you're starting to do that, then that's what we're going to do. So what I want you to do, and I want you to pause the video, and what we're going to do is I want you to, for 2 minutes, I want you to do that kind of breathing. And when you're done with the 2 minutes, I want you to come back and then we'll have a little chat. So you can pause the video now. Okay, welcome back. So I want you to try and do this every day for the next 2 weeks. And I want you to do that for 2 minutes of every day. And the reason for the 2 minutes, it's not a totally arbitrary number. It takes roughly that long in order for your body to dump some of the stress chemicals. So you're not going to notice a major change in how you're feeling unless you're going for at least 2 minutes. Now, for some people, if they've been really anxious for a long time, or you don't know how to relax, that 2 minutes can seem a long time, or you might start to feel symptoms of anxiety. If that's the case, I want you to stop whatever time it is, even if it's 30 seconds, and that's what you just acknowledge that's what you're capable of at that point. And then you come back the next day and it's like, okay, so I did 30 seconds yesterday. Can I do 35 seconds today? Until you can get to the 2 minutes. Now, if you feel like, wow, I really like this technique and can I do more? Absolutely. So you can go and do this for 20 minutes if you want, because this is an excellent technique to relax. This is one of the techniques that we often teach to people, because there always seems to be one of two camps. One, people feel more anxious in the morning, and so we'll get them to try and use this breathing technique when they first get up. Or what I find when I was in, in regular practice is I found that a lot of people had a hard time sleeping. And so this is an excellent technique to do when you can't sleep. So this helps to disengage those anxiety symptoms, especially the rapid thinking, and helps you to kind of at least put you in the right mood where you might get some sleep at that point. So I want you to try and give that a go. So write down in your binder that your assignment for the next 2 weeks, and you can pick which time of the day that you want, but I want you to dedicate 2 minutes out of every day minimum where you're doing this technique. And then I want you to see, like what you can do is you can kind of gauge how you feel before. So you can rate it. I like a 1 to 10 scale. You're gonna hear the 1 to 10 scale a lot in these classes. So 1 to 10, 10 being the most intense sensation, 1 being not at all. And so before you start the breathing technique, you can put in there and you can journal that in your binder as well. So if you were at a 6, before you started breathing, were you at a 6 when you were done the exercise? It might be higher for some, but the goal would be is that's lower. The goal isn't necessarily to get it down to 1, because that might be a bit of a stretch. Maybe there is something very stressful that you're kind of dealing with. And so, but even if you can get it to a 4 is a lot easier to deal with than a 6. So good luck with your homework. Thanks for tuning in, and we're going to see you in the next session.